Thank you, Governor. Good afternoon, everyone. Thank you all for joining us today. To get started with the data, as the Governor said, we have 173 new cases to report. There are 103 people currently hospitalized with COVID-19 in Rhode Island. Of these people, 8 are in an intensive care unit and 5 are on a ventilator. Sadly, we have 1 new fatality to report today. This individual was in their 70s. It's important to acknowledge our sympathies continue to be with the families of the dear Rhode Islanders that we have lost. That's what helps us stay focused on what we need to do in being vigilant. So I usually wrap up with an overview of what we're seeing in our case investigations, but I want to get into that now because it's directly relevant to what the Governor was discussing about young adults in particular. Between September 15th and September 21st, we identified 685 new cases. 203 of those cases, which is 30%, were among people in the 19 to 24-year-old age bracket. People in this age group make up 9% of our population, but they represented 30% of our cases. That compares to 81 cases the previous week, which was 14% of that week's cases. Another trend we are seeing is people are not always being completely forthcoming with our case investigators when they get called by the Rhode Island Department of Health. I want to really speak to this. Please, we need you to answer the questions that are asked honestly and openly. We need you to answer when we call and to work with us. It's recognizing whether you are a young adult or a senior. The purpose and the goal with case investigation is to keep you safe and the people around you healthy and safe. We cannot do that unless you answer when we call and you provide us with the information that we need. We need your help in being able to do that effectively. Another way that people can help us is by making us aware of social gatherings that are occurring that seem too loud or too large, loud as well, seem too large or where people are not masking. We have a number to call that we want to continue to make known to everyone if you want to report a social gathering that is larger than 15 people or involving people who are not masking effectively. That phone number is 401-764-5554. The phone line is anonymous, so please don't hesitate to call. That's how we can all work together to help ensure that we are keeping each other safe. We need to turn the numbers around that we are seeing. As the Governor said, we have been doing a lot of testing, particularly within our K through 12 community for students, teachers, and staff. We also have more capacity than demand right now. We've done roughly 4,000 tests, as have been mentioned, while we have capacity to do 5,000 tests a day. So I want to continue to mention, particularly if you have symptoms, if you work in a school and are feeling any symptoms of COVID-19, call and make yourself an appointment to get tested. Remember, the earlier in the day, the better. If the student in your life has symptoms of COVID-19, as early as needed, call and make an appointment for him or for her to go ahead and get tested. Do not delay. We have a system that's set up, that's rapid, that's catered specifically to our K through 12 community, one of the most advanced systems with this in the country. Let's use it. Let's make sure that we use the capacity. The number to call is 844-857-1814. You can also go to our website, health.ri.gov/COVID, and click the Testing tab on the left. As the governor said, we have roughly 163 K-12 cases to date total. I was asked last week as well what we are seeing in terms of symptomatic versus asymptomatic people within the K-12 community who are testing positive. Among people in the in-person learning community, we have seen more people displaying symptoms. 63 of the 84 were displaying symptoms. It's still early in the year, but it's also important to note that we are not seeing widespread outbreaks. That means we're not seeing secondary or tertiary transmission, otherwise described as a second or third wave of illness. That's an important marker. As people can see in the school data that we updated online today, we have had schools with more than one case, but it's important to recognize that those cases tended to have a common exposure, oftentimes even outside of school, whether siblings or sports teammates. One other update that I want to provide is on our alternate hospital sites, which people have sometimes called our 3 field hospitals. As people may have seen in the news earlier this week, we decided to decommission 2 of those 3 hospitals. We had established an alternate hospital site at the Rhode Island Convention Center in Providence, a second one in Cranston, and a third one at Quonset in North Kingston. We've chosen to decommission the hospitals in Providence and North Kingston while keeping the third facility stood up in Cranston. This was a decision that was made very carefully, just so that everyone really understands. We looked at a decade's worth of flu hospital utilization data in Rhode Island, as well as we looked at what we are seeing now and what we could be seeing when it comes to COVID-19. We determined that we have the capacity to safely care for patients at the volumes we could conceivably see without those 2 facilities going forward. Another piece of the puzzle that's critical is that the traditional hospitals throughout the state have had several months to refine their surge plans, and they have all learned from experiences with COVID-19 patients. They are all better positioned to ramp up now should the need arise. And none of the hospitals currently are overwhelmed in any way. Although these 2 alternate hospital sites were never used, I want to recognize and thank the teams at Care New England and Lifespan who did a tremendous amount of work to get these sites ready to go and to provide high-quality care. We asked for their help during a very uncertain moment, and they stepped up and did a phenomenal job. I also want to recognize the team overall, Rhode Island National Guard, the Governor's Office, the Rhode Island Department of Health staff, REMA, so many across the board. Particular, Alicia Mahalakas is an excellent example of one of the many superheroes I think of when you look at the entire statewide response. So I want to say thank you to her. Oftentimes you'll hear me say, it is truly a team effort. She and so many others are examples of the types of teams that have worked diligently together to help make people safe in Rhode Island. All right. The last topic I want to address today is Halloween. As the governor said, we want Halloween to go on, but it has to be done differently this year, just like so many other things that we're doing is being done differently. First and foremost, everyone knows this, we're going to continue to say it. This is particularly important. If you are feeling sick, you cannot participate in trick-or-treating this year. That means not going out from house to house with symptoms or not leaving candy out for trick-or-treaters. Both of those should not occur if you are feeling sick in any way. All parents should do a symptom check with their children before heading out, please. That means actively determining whether the child in your life has a cough, fever or chills, shortness of breath, muscle or body aches, diarrhea, headache, sore throat, nausea, or any of the other COVID-19 symptoms we have been discussing. It's critical to do that in advance. If you are going to be trick-or-treating, stay with your regular contacts, your small, stable groups. For people who expect trick-or-treaters, you should not open the door and offer a bowl for kids to reach in and mix and take candy out. A creative way to do this differently is to leave individually wrapped goodie bags outside. Alternatively, you can leave individual pieces of wrapped candy on a baking sheet that's spread out. So no one's touching something more than once. Someone is able to go and pick it up. Children can enjoy the experience, and we can do it safely. Put out a few at a time as you're putting out either the goodie bags or individually wrapped candy. And put more out if needed when trick-or-treaters are not on your stoop. People at home should be washing their hands regularly. People who are going from house to house should bring hand sanitizer along and use it each time in between, or as many times as you can. As we are saying, and will continue to say, masks are absolutely required during Halloween and trick-or-treating. To be clear, that means using one of the face coverings that we have been talking about and wearing for a few months now. It does not mean using a Halloween mask from your costume to feel like that replaces the cloth face covering. The Halloween mask is not enough. Some examples of what people can do is face painting and then designing a face cloth covering that aligns with your Halloween costume to make sure that that's being worn. Please make sure that we continue to mask. That is the critical tool to help make Halloween safe this year. And finally, as the governor said, and we cannot say enough, this is not the year for Halloween parties with people from outside of your household. We need people masking at all times with anyone that you are interacting with outside of your household. We've posted guidance online about Halloween as well as fall activities more generally. Apple picking, going to farmers markets, taking hay rides. You can find all of this guidance on reopeningri.com in the Parks and Recreation section. We want to be able to have Halloween this year, to allow this all to go forward as we've described. But for that to happen, we all need you to follow the 3 W's between now and then and beyond. We need you to wear your mask, wash your hands, and watch your distance. 6 feet between you and others.